Hi everybody, and welcome to our training video on enrolling an employee and their dependents in Benefits 24/7. And as your presenter today, my name is Debbie Crumples, and I'm a member of the Outreach and Training Unit within the Employee and Retiree Benefits Division. So first, before we get started, here are some important reminders that the preferred web browser for logging into Benefits 24/7 is going to be Chrome. And here's a link that will take you to the Benefits 24/7 training environment, because for now it is only a training environment until the live version of Benefits 24/7 is available on the PEBB Benefits Administrator website in early May. Okay, so as you can see, I am already logged into the Benefits Administrator dashboard with the Department of Ecology as the employer. And in today's demonstration, we're going to walk you through how to go ahead and enroll an employee and their dependents into the benefit options that the employee has elected. And we're going to go ahead and use that employee that we used when we did the video for adding a new subscriber into Benefits 24/7. And that employee was Donald Smith with the Department of Ecology. But before I get started, I would just like to say that the process we're going to walk through today will be exactly the same for your employees if they were to go ahead and log into their own Benefits 24/7 account and do their self-enrollment, or whether you as the BA key their enrollment in Benefits 24/7 from paper forms that the employee decided to use to do their enrollment process. So I'm going to go ahead and click on the Manage Subscribers tile. And we will search for this employee, Donald Smith. So I'll type in the last name, do a search, and go ahead and click on Donald Smith and click on Manage Associated Subscriber. So let's go down the screen a little bit. As you can see, we are managing that employee. Here is the Benefits Administrator tabs or dashboard. And if you scroll down the page a little bit, here is your subscriber or employees dashboard welcoming them. Okay, so to get the actual enrollment process started, there is a blue box here, and if you hover over that, you can tell that it is a clickable item that will go ahead and start the enrollment process when either your employee clicks on that, or if you're processing it for them via the paper enrollment forms, then you would do that. So the dates on here are March 23rd through April the 24th. That just represents the employee's 31-day eligibility window, that when they log into their own Benefits 24/7 account, that is the time frame that they're going to be able to do this self-enrollment within the application. Also, it says for coverage, April 1 of 2023, that's just kind of letting the employee know when their coverage will begin. So just know that if your employee signs into their Benefits 24/7 account on April the 25th, this newly eligible wizard will go away. But when you're signed in as a benefits administrator, this will remain out there for that 60 days outside of that window, because you are allowed to go ahead and key this information within those lower limit dates. Okay, so let's go ahead and click on the wizard. And the first thing that it's going to ask is, do you have dependents to add to your account? So part of today's training is also going to be enrolling a subscriber and a couple or few of their dependents. So I'm going to go ahead and say yes and click on next. Now, if they did not have dependents, you would just click on no, and then that would be fine too. So this screen is going to take you out to some information about dependents, and good information for your employees, letting them know about dual enrollment, also what verification documents they are going to need to enroll their dependents. So we will go ahead and first enroll a spouse. So we'll go ahead and just use this last name. Their birthday will be February 1, 2017. sex assigned at birth will be female, gender identity female. Okay, so the relationship. From these options, I'm going to go ahead and choose the spouse. It wants to know the partnership date, so just know that it's partnership or the marriage date. That's just kind of a terminology thing that we're used to seeing for registered domestic partners, but it also applies to the marriage date. So we're going to go ahead and say February 15th, 2019. The qualifying reason will be a spouse. And this is where it would allow you to select if it was a state registered domestic partner. So we'll go ahead and say spouse. Let's give this spouse a social security number. Okay. Now it's going to ask me, is the residential address the same as the subscriber? And if it is, I'll click here. If it is not, then you can go ahead and fill this information for this dependent. But I'm going to go ahead and click on the same as subscriber. And now we're going to click on let's add coverage to this dependent. So now we are being asked, which benefit would you like to enroll this dependent in? Well, we will go ahead and select medical and dental. And if you are an employer group who has medical only with us, then this dental option would not even show up for your employees. Also, based on the dependent's birth date, this system is sophisticated enough to be able to tell if they are old enough to have to attest to that tobacco attestation. And based on this dependent's birthday, we are required to go ahead and do that. So we'll click on that. And basically, it's going to take you to a page that just talks a little bit about the surcharge attestation. It's $25 if it applies to your account. And it's asking, does this surcharge apply to this dependent? And we're going to say no, this dependent does not use any tobacco products. And then it's going to bring us to the continue to the spouse or state registered domestic partner surcharge attestation. So again, the system is sophisticated enough to be able to know what kind of dependent it is, and in this instance it is a spouse, so we will go ahead and click on that. If it was a different kind of dependent, then this would not even show up. So we'll click on that. So this takes us out to the spousal coverage premium surcharge page, where there's just some information here that tells the employee if they meet the criteria, then they will be paying this $50 per month surcharge. So a little further down the screen is going to be a series of questions that will come up one after another as your employee goes ahead and answers those. So the first one is the employee covering their spouse? Well, as you can see, that's already checked yes, because we are trying to go ahead and add their spouse, but now the employee is going to need to continue to answer questions. So if they answer yes to this one, and then the next one, let's say they answer no. Well, the first time they answer no, the system is automatically going to populate them to a no surcharge. And then from there, all the employee needs to do is click on next. But I'm going to go back up and say that the employee went ahead and clicked on yes to this question, and yes to this question, and yes to this question, and then yes to this question. So as you can see, a couple of things I will point out, that because they answered yes to all of these questions, it's automatically going to charge them the $50 surcharge. But there is also another message that comes up that says the employee may have to pay that surcharge, but we're not sure yet. So we need them to go out to this spousal calculator, and once they fill that information in, it will help them determine if the surcharge really does not apply to them. And if the answer is that it does not apply to them after all, then the employee or you as the benefits administrator can come down and click on no, so that they do not have to pay that surcharge. So I will go ahead and click on yes, leave it as the system defaulted, and go ahead and click on next. So it's just saying, based on how you did that attestation, you will not be paying this $50 per month surcharge. So now we will click on to proceeding to the dependent review. So here is where it's saying just take a look at this and make sure it's what you want it to be. So here is the spouse's name, their date of birth, the type of dependent they are. They are being enrolled in medical and dental, and no surcharges are going to apply to them. So we can go ahead and save and finish this dependent. And as you can see, the wizard is going to pop you out to this page here, and it's going to say, hi, you have successfully added your spouse. Do you have additional dependents that you would like to add? And we're going to say yes, because we're going to show you how to enroll a child. Now, if you did not have any additional dependents to add, you would just say no and then proceed. And then it's just going to bring you to the screen where you can add that child. So we'll go ahead and type in child Smith and go down to the birth date, January 1. How about 2019? Sex, female, gender identity, and we're going to choose the relationship as a child. Now, the Benefits 24/7 application is also sophisticated enough to identify the birth date and that this child would not be a dependent with a disability. So it's just saying, yes, dependent without a disability. We're going to go ahead and say this person currently has no social security number or that we have information for. And this dependent has the same residential address as the subscriber. Go ahead and click on that. And let's go ahead and add coverage to this dependent. Again, it's asking which benefits would you like to enroll this dependent in. And we're going to say in this instance, we only want to add the child to dental. So we'll click here. We will do the proceed to dependent review. So it's just going to show you who this child is. Here's their name, their date of birth, the type of dependent they are. They are not enrolled in medical, but they are enrolled in dental, and no tobacco surcharge, and this spousal surcharge does not apply. So based on the birth date, as you can see here, it's automatically going to say this doesn't apply to this dependent. So we will save and finish this dependent. And it's letting you know that you have successfully added this dependent child, asking again, do you have additional dependents to add? So I'm going to say, yes, we have one more dependent. And click next. And I'm going to go ahead and add this subscriber's stepchild. So, okay, so now we're going to give this stepchild a name. We're just going to call it stepchild Evans as the last name. The birth date would be 2/1/2019. Sex assigned at birth would be male, gender identity male. And then we will go down and choose the relationship, and it is a stepchild. So again, the system is sophisticated enough to identify again by the birth date that this is a dependent with no disability. And I'm also going to click here that we do not currently have any social security information for this dependent, and that the residential address is the same as the subscriber. So we will go ahead and add coverage to this dependent. Again, it's asking which benefits would you like to enroll this dependent in. And again, we're going to say dental only, and go ahead and do the dependent review. So as you can see, it's telling you that here's the child's name, the birth date, and which type of dependent they are. They're not being enrolled in medical, but they will be enrolled in dental. The tobacco use surcharge premium does not apply based on their birth date, and the spousal surcharge does not apply based on the type of dependent they are. So we will go ahead and save and finish this dependent. It's now telling you that you have successfully added this stepchild, and do you have additional dependents to add? And for this training, we're going to say no, and we're going to go ahead and click on next. So this screen is just going to bring you up through the dependent review of all the dependents you're adding. It's just going to summarize it by their name, date of birth, what type of dependent they are, which plans they're enrolled in, not really plans, but if it's medical or dental, how the surcharges apply or not. And it also gives you options if you need to go in and make any of these types of changes to go ahead and edit that dependent and do that. But we will not be doing that now. And it's just reminding you that you're going to need to provide proof that these are your dependents. So we'll go ahead and click on the Let's Upload those eligibility documents for your dependents. So now we're on the document upload screen, which just tells you a little bit of information, or the employee, that they are going to need some verification documents verifying that these are actually their dependents. So here's some information about what they can provide if they're enrolling a spouse, or if they're enrolling a state registered domestic partner, or to enroll children or stepchildren. So a little further down this page, there is a section for uploading those dependent verification documents. So just notice that these are the file types that are allowed. So what you need to do is just select the files. So this would be when an employee is going to upload their documents. So they are going to choose tax return for their spouse. So as you can see, that is uploaded. And if I go a little further down the screen, here it is here as well. It's asking you, what is that document type? Well, it is a tax return. And which dependent does this apply to? Well, this applies to the spouse. So that's good. It's asking you to go ahead and upload and confirm. But because we have two other dependents that we need to also upload documents for, we're going to select those files as well. So now I'm going to do the birth certificate for the child. And as you can see, that's loaded here, as well as a little further down the page. So it's saying, what document type is that? I'm going to say a birth certificate, and that goes to the child. And then I'm going to go ahead and upload a file for that stepchild. So I'm going to put the stepchild's birth certificate. If you come down the page a little further, it's uploaded here, and it's also here. It's asking me for that document type, and it is a birth certificate. But as you know, stepchildren need to also have some kind of documentation that shows the relationship to their natural parent, and then that parent to the subscriber or employee. And in this instance, that could be the tax return up here that was used to verify the spouse. So I'm going to go ahead and use that tax return document for this stepchild as well, and then this birth certificate for the stepchild. Then that meets all of the document verification needs for these dependents. So now we'll go ahead and upload and confirm these changes. As you can see, it brings you to the screen that's just confirming that those dependent verification documents were uploaded successfully. So a really quick note here for BAs who are going through this enrollment process for your employees because they elected not to do the self-enrollment and benefits 24/7. Just remember that you would not be loading documents for dependent verification into the Benefits 24/7 application because you would already have those paper verification documents in front of you, and you would just skip through that section to get to the next part that we're going to do here. And remember that dependent verification is not done during the enrollment process. We will be doing that in another video so that you can understand how to do that from paper documents. Okay, so back to proceeding to elect coverage now. So as you can see, for newly eligible employees, it's saying they're defaulted. They are not currently enrolled in a valid plan. So they're just saying here are all of the options available to you to choose from. So the employee is going to choose which plan they want. And again, if you're using paper enrollment forms, you will just follow all of that information off of the forms. So in this instance, I'm going to go ahead and say they want Uniform Classic and click on that. To the right is how much that premium would be for them based on how many dependents they had enrolled in the plan. And here also is the option to waive that medical coverage if they are going to do that. So I'm going to go ahead and click on Next. and it's asking me to also choose my dental plan. So in this instance, I'm going to choose the uniform dental plan, and I'm going to go ahead and click on Next. Okay, so now we are out at the confirmation of the employees' benefit elections for themselves and their enrolled dependents. So I am just going to scroll down the page and go ahead and click on Confirm, and then let's go complete the tobacco attestation. And on this page here, it just talks a little bit about that surcharge. So I'll click Next, and it's asking, does the tobacco use premium surcharge apply to you? So you here is the employee or subscriber. So I'm going to go ahead and leave that as no, that the employee does not use tobacco products, and go ahead and click on Next. And here's just a legal notice. Once I've read that, I will click on Next. And it's just letting me know that this employee will not be charged the $25 surcharge. So now we will confirm this, and let's go out to the supplemental coverage options. Okay, so this takes us out to the supplemental coverage options page. So the first one is information here about the long-term disability insurance. So it's going to tell the employee about the employer-paid version of LTD and what their options are for employee-paid LTD. It has some rate information based on which plan the employee chooses to enroll in. And as you can see, the employee here is already enrolled in the default 60% plan. But if they, within that 31-day eligibility window, choose to instead be enrolled in the 50% plan, they would just click here. Or if they want to decline employee-paid LTD coverage, they would just click here. But I'm going to go ahead and leave this employee at the employee-paid 60% plan. And as I go down further on the page, oops, sorry about that, we have some information about the life and accidental death and dismemberment insurance. So it just tells the employee what their basic coverage is, and if they would like some additional life insurance above that, then they could go out to the MetLife My Benefits portal and go ahead and make application for that. Here is a link and some really good information about our flexible spending arrangements and our dependent care assistance program. So employees coming on board mid-year can go out to this link and do a mid-year enrollment. This is where they would learn a little bit more about what's eligible for these expenses and then to enroll in the DCAP program. Here is some information about the health savings account through the Health Equity website for employees who go ahead and enroll in a high deductible medical plan with that health savings account. This allows them the option to go ahead and make a contribution into their health savings account as well from their payroll or from their bank account if they want to work through Health Equity to do that. Also, here is a link out to the program's wellness program called Smart Health, and also a link to Liberty Mutual's website for the auto and home insurance. So just a couple of things I'd like to say about these supplemental benefits. For state agency and higher education institution employees, all of these benefit options here on this page will apply to your employees, and they will be able to go ahead and enroll in these. If you are from an employer group with full benefits through the PEBB program, the one thing that would not apply to your employees is the flexible spending arrangements and DCAP program. If you are a medical-only employer group, your employees would only have access to the health savings account, the Smart Health Wellness program, and then the auto and home insurance through Liberty Mutual's website. So now I will go ahead and do a continue and review. And now it brings me up to a summary of coverage for this employee. And basically it just shows your employee's name, who they work for, themselves and all of their enrolled dependents here with their medical and dental coverage dates if they apply, what medical plan they've enrolled in and what dental plan they've enrolled in, and what their premium will be out of their paycheck. So for our employer groups, there will be no dollar amount here for a premium, and that's because Your employees will, on this statement, be referred to their payroll or benefits office staff for that information because you determine the rates differently from our state agency and higher ed institution employers. So I will go ahead and click on Next. And it brings up the next page for life insurance, which just shows the employee enrolled in the basic coverage and again provides that link to the MetLife My Benefits portal for additional coverage. And for the long-term disability, it just shows that this employee is enrolled in the employer paid LTD plan and they have the supplemental LTD coverage at the 60% level. So I will go ahead and click on Next. I'm going to read this legal notice. Go ahead and confirm. And now the system is telling me that I'm all done. I can download a summary of my elections below. And if I do this, if I click on this, I will show you what that looks like. And I will minimize this just a little bit. It's that same summary of coverage that you saw through the confirmation page. Okay, I'll go ahead and get out of that. Okay, so that employee is now enrolled and has their dependents enrolled. So I will go back to the dashboard. Okay, just a quick reminder that yes, this employee and their dependents have been enrolled. However, when your subscriber or employee adds dependents, there is still the dependent verification process that we will be covering in a future video. So now that you know how to enroll a newly eligible employee and their dependents in Benefits 24/7, here are those follow-up resources in the event that you have any questions about Benefits 24/7. So first, you can send us your questions through the HCA support portal, and when you create your ticket, just be sure to select the Benefits 24/7 online enrollment system as your inquiry type. You can also reach out to our outreach and training team at the 800 number that's listed here. And even though we don't have this available yet, there will be a link coming soon to a Benefits 24/7 Benefits Administrator User Guide. And finally, we will be continuing to create and post some additional detailed training videos for Benefits 24/7. And just know that the user guide and videos will be located on the PEBB Benefits Administrator website once they do become available. And for your employees, when they need help with Benefits 24/7, you are going to be their point of contact. So that wraps up our video training on enrolling an employee and their dependents in Benefits 24/7. Thank you for watching.